There is a new study out, and I knew you were anxious to hear about one, that more children hospitalized due to COVID-19. Healthcare specialist Dave Johnson on the line here with us this morning. Dave, give me the inside scoop. What's the deal here? Kids are now getting this?
Well, good morning, Bill. Yes, not getting it at the same rate as adults, but definitely getting it. Children are 22% of the U.S. population overall, and 9% of the COVID cases. And when you look at emergency room visits and hospitalizations, they're going up. So, kids are getting it.
Do we know particularly why this? Because this has been the population that we said really, is not being that much that affected.
Yeah. The part that concerns me the most, Bill, are the mental health visits.
Mm-hmm.
They're up. Emergency visits to the hospitals are up 25% for children in the 5 to 11 age group, and even higher.
Wow.
31% for children in the 12 to 17 age group. Reasons, they're all pretty obvious. Disrupted routines, fear of sickness and family loss, social isolation. And we're seeing all the signs, right? More suicide attempts. Unfortunately, even more suicides, signs of despair, hopelessness, self-harming behaviors. That's part of what we're dealing with. And again, sort of like this recovery, it's the top half of the economic spectrum in the country is doing much better than the bottom half. So there's a real social inequity component to this as well.
Once again, Dave, we talk about the cure being worse than the disease. And that's what we're facing because the CDC has said get kids back to school, taking all the proper protocols. And we were talking with one of our reporters just a few minutes ago and said, that we've got kids back in our private schools here that have had no problems whatsoever, and they've been back full bore since August.
Yeah, this is what my friends in New England would call a wicked problem, right? The private schools do tend to have more resources, and so they are able to manage social contact or limit social contact to limit infection. But what we've also discovered, there's yet another study right out of the University of Florida that says that children are 60% more likely to spread disease than adults over 60. And so when you pack kids back into school without the proper, public health precautions, the likelihood that they will spread it to one another increases as well. And while they don't get sick to the same extent, they pass it along to their parents and caregivers at fairly great rates. And that's probably, again, because parents spend a lot of time with their kids, right? So a wicked problem.
Yeah, it is. Healthcare specialist Dave Johnson with us. And Dave, does this have anything to do with all the new strains that we've heard about now?
I think it's too early to tell, from a study perspective, because they have to go back and retrospectively look at the data. But here's what's scary about these new strains. COVID, like all viruses, spreads exponentially. So 2 goes to 4, goes to 8, goes to 16, and so on. With these new strains that go faster, it goes more like 2 goes to 4, goes to 16, goes to 64, goes to 256. So we're in this race, one, to prevent the strains from coming here in the first place, which is why we're doing some of the protections on travel. But then secondly, to have enough of the public health behaviors, because viruses decrease exponentially as well. So in many ways, wearing the masks and social distancing and all of that has a more magnified effect relative to preventing disease spread. Whereas a vaccine, which is our ultimate cure, is more additive, right? It's 1 + 1 = 2 + 1 = 3 as you do them kind of one by one. So we've got this kind of mathematical challenge that's underlying all this, as well as again, as my friends say in New England, just a frickin' wicked problem.
I see. Yeah, and of course, if you wear 2 masks, that's even better, says President Fauci, and maybe even 3 would be better than that, Dave.
I don't know. I don't know about 3, but
Okay. Right.
yeah, I do know these new strains sometimes penetrate one mask. So
Okay.
better safe than sorry, I guess.
I suppose. All right, Dave, we appreciate it, pal. Thank you, sir.
Yeah, thank you, Bill.
All right,
Bye-bye.
sir. Take care.